After surgery, the patient will go to their hospital room, which is typically on the second floor in the orthopedic unit, and we have nurses who are trained in orthopedic care specifically. It's expected that you'll get up and do some walking the day of surgery, and typically our patients will get up at least 6 times per day that they're in the hospital. Once in the morning and once in the afternoon with the physical therapist, and then at least a couple walks with your nurse or tech in between those therapy sessions. So patients, when they go home is dictated by how quickly they're recovering. Some patients will go home the next day after surgery. Some patients will go home the second day after surgery. It's pretty rare for patients to go home after that unless there's some other issue going on from a medical standpoint. So upon discharge, you'll go home. Typically we have home health arranged so that they will come to your house, and for the first 2 weeks after surgery, you'll do therapy at home with a home health nurse and or home health therapist, and they will, help manage your wound. They'll help get you going with your exercises and do all of that without having to get you out in a car and make it to therapy. Some patients I've had request to begin outpatient therapy immediately after surgery, after discharge, and that's okay too. I'm not against that at all. But most of our patients appreciate being able to do that at home because of the difficulty getting in and out of a car and getting to and from surgery, to and from therapy. So patients will ask questions such as, how long does it take to get over this? It's about a 2-month recovery typically, and I define recovery as the point at which you're getting around without assistance and not entirely pain-free, but your pain is becoming less and less of a consideration. Maybe you'll have a day or a period of time during the day when you forgot altogether that you'd even had your knee replaced. Your pain is diminishing in a steady way, and you're able to return to a majority of activities such as shopping and getting out and into the community. Some people recover much quicker than 2 months. Some people are basically done in 4 weeks or 6 weeks. Some patients will take a little bit longer. Oftentimes patients will continue to have some level of stiffness in their knee for a period of months afterward. We call that startup pain. And startup pain basically is those first few steps you take in the morning or the first few steps you take after you've been in a car for an hour or so and your knee's a little bit stiff. The startup pain has to do with the scar tissue around the knee maturing and turning into a more sophisticated version of scar tissue, and it tends to lessen over time. And finally, people ask about when can they drive again as far as in the postoperative period. Again, some of that will depend on whether you have a right knee done or a right hip, or a left knee done. That basically, and it also depends on whether you have an automatic transmission or not. I don't tell my patients a particular day that they're prepared to drive. And the reason for that is the results vary from patient to patient in terms of how quickly they can get their foot from the gas to the brake. Some studies have said that it takes up to a couple of months for that to return to be as quick as it was before surgery. I think patients are smart enough to know when they're safe to drive a car. I always make it clear that patients cannot be driving while under the influence of narcotic pain medication, but otherwise they have to use their best judgment as to when they feel safe and it's appropriate for them to drive again after total knee replacement.